Hi everyone, welcome to MedGoto. In this video, we're going to be covering another type of necrosis, which is liquefactive necrosis. Yesterday, we covered coagulative necrosis. Before we go to liquefactive necrosis, I just want to appreciate everyone who have subscribe to the channel, sending in their comments. I really appreciate those comments. And then for people who are yet to subscribe, please don't forget to subscribe to our channel and support our community. Put on the notification bell so each time we upload a video, you can get the notification. Having said that, let's move on to liquefactive necrosis. So liquefactive necrosis, by definition, is a form of necrosis whereby the tissue becomes liquefied, right? So the tissue basically become watery. And like we mentioned, we said when you look at this necrosis, the way we name them is based on the gross appearance. So like this one, from the word liquefactive necrosis, so that means I'm expecting those necrotic tissue to be what? To be liquid, right? What's the mechanism of this liquefactive necrosis? So the mechanism is basically the hydrolytic enzyme. So this hydrolytic enzyme, right, is going to hydrolyze those tissue, right, or liquefy those tissue, and that's how we get liquefactive necrosis, right? And then where is the hydrolytic enzyme coming from, right? So the hydrolytic enzyme could come from neutrophil. So neutrophils could release those hydrolytic enzymes, and then we usually get neutrophil maybe as a result of acute inflammation. So if somebody have like maybe neutrophil from bacterial infection, right? So this bacterial infection will release, will attract neutrophil, right? Because the neutrophil is trying to get rid of those bacterial infection, and those neutrophil can release hydrolytic enzymes. And as it's trying to deal with the bacteria, at the same time, it's also liquefying the tissue. So that could lead to liquefactive necrosis, right? The other thing where we can also get hydrolytic enzyme from could also be from lysosome, right? So when you have some necrotic tissue, right? So the lysosomal enzymes, right, from the necrotic tissue could also hydrolyze those tissues. So all those lysosomes in those necrotic tissue, they start releasing their hydrolytic enzyme because remember, in those necrotic tissue, they are dying. So those lysosomes there too, they are going to the membrane is going to be permeable, or they have to rupture. So those hydrolytic enzymes in them will also come out, and that will also digest the tissue, and that can lead to liquefactive necrosis. So let's move on to talk about examples of liquefactive necrosis. I always love to do examples, so it's very easy for us to remember. The first one I'm going to talk about is bacterial abscesses, right? And then we can use classically the example of lung abscess. Does somebody have lung abscess? So for instance, so let's say this is the airway and this is the lung, just for illustration, right? So if somebody aspirates some of their oropharynx, right? And as all know, we know that aspiration normally occur mostly on the right side, right? But because the right midstern bronchus, right, is more wider and it's more vertical. So as a result of that, anytime there is aspiration, it tends to go on the right side, right? So let's say somebody have like a bacteria, they aspirated into their lungs, and then some of those bacteria get into their lung, right? So those bacteria in the lung in that area. So those bacteria now, right, can create acute inflammation in the lungs. So that could lead to acute inflammation. And what do I mean by acute inflammation? So bacteria in the lungs, release of acute phase cytokine, which we have to talk about when we get to inflammation, and neutrophil chemotactics, inviting neutrophil to those area. And then once neutrophil gets to those area, neutrophil want to release those hydrolytic enzymes, right? Release hydrolytic enzymes, right? And those hydrolytic enzymes is going to start digesting the tissue, and that can create like a liquefactive necrosis inside the lungs, and that can lead to lung abscess, right? So we want to digest those tissue there, and then once you digest and liquefy them, right? So those tissue will settle down, right? So those liquefied tissue, they want to settle down, right? So you're going to create like a cavity. So they settle down, and on top of it, they want to be so this on top needs to be like an empty space, like an empty space is usually occupied by air, right? So that will create what we call like a cavitary lesion in the lungs, and they're going to see what they call the air fluid level. So cavity and air fluid level, right? So once you see this on the exam, like somebody who have high risk for aspiration, having recurrent fever, and you do a chest X-ray, you see that cavitary and air fluid level, you always want to think of lung abscess, right? So what are the risk factors for lung abscess? Like I mentioned, you always want to be thinking of things like alcoholism, because people are alcoholics, they are high risk for aspiration. Seizure patient, right? Somebody who's having recurrent seizure, right? Neurologic disease. Example, Parkinson, right? Because these people, they're having trouble clearing their oral secretion, so they are high risk for aspiration. And then what are the bacteria that you want to be thinking of in aspiration, right? So you want to be thinking of those anaerobes bacteria, for instance, like Fusobacterium, staph, right? Strep. Also, Klebsiella is also very common, particularly with alcohol, right? And any of these could lead to get into the lungs and lead to this lung abscess, right? And like you mentioned, presentation, so clinical findings. So those patients, they want to have fever, right? They want to be spiking so much fever. They want to have foul smelling, sputum. So whenever I hear foul smelling, I always think of anaerobes. It's just like in the case of Clostridium deficit, whereby they have this watery foul smelling diarrhea. So fever, foul smelling, sputum, right? And of course, they could also be having weight loss. So when you see all this, you're thinking of in somebody who have a risk factor for it, you're thinking of lung abscess, right? Aspiration. And on the chest X-ray, like you mentioned, you're going to see, you can see those cavitary lesions, mostly on the right, because that's where the aspiration tends to go to. So cavitary lesion, right, with air fluid level. Okay. And then when we talk in terms of the treatment, right, in terms of the treatment, you want to cover them for gram positive, right? You want to cover them for gram negative, right? And then most importantly, you want to cover them for anaerobes, right? Example maybe with something like clindamycin. They want to cover that will help them to cover the anaerobes. So that's lung abscess. And when we get to respiratory system, we're going to go in details with lung abscess, and we're going to talk in details about the antibiotics. So that's one of the examples of liquefactive necrosis. Another example I also want us to talk about is CNS infection. If you guys remember yesterday, I will mention that anytime we have any infection to any tissue in our body, that normally leads to coagulative necrosis. So that normally leads to coagulative necrosis. And we said that the only